Hi everyone, I'm Georgia. I'm a PhD candidate with the Trobe Uni and CP-Achieve, and I also work as a physio at St Vincent's Hospital here in Melbourne in the Young Adult Complex Disability Service. So today I'm going to share some of the findings from my PhD research. So as we start, I would really love for you all to just reflect a little bit on why you exercise and what works for you personally. I think most of us know that we need to exercise for our health and both physical and mental well-being, but it's not always easy to get started and it's not easy to keep it up. So when you think about what works for you, is it outdoors or indoors? Is it with someone or by yourself? Do you like weights, stretching, cardio, team sport or not? Why is it that you have those preferences? So when I first started my PhD, part of my work role at St Vincent's was supporting physical activity participation in adulthood for young people with CP. And we know from the literature that adults with CP often experience a functional decline as they age, and we would see that in clinic as well. So being a physio, of course, I wanted to address that with exercise. But I also saw a lot of young people reaching adulthood who were sick of physio and rehab. And I guess that's what sparked my interest in a more participation-based focus and looking at community options for these young people, of which there were very few. So my systematic review was therefore focused on looking at the barriers and facilitators to community physical activity for young adults with any physical disability. We reviewed 19 studies that investigated barriers and facilitators. Many of these were qualitative studies interviewing young people with disability. And what we found is that really it was a balancing act. So the same factors could be barriers or facilitators depending on their presence and absence. But it really boiled down to three critical factors: the physical environment, the social supports in place, and the experience of social connection. So the physical accessibility of exercise settings was almost exclusively reported as barriers. Usually it related to inappropriate equipment, equipment not available, and also the change rooms and physical access to facilities. The social supports included support from families, peers, recreation staff, and organisations. And when it was present, it was usually a good facilitator. And then there was this feeling of social connectedness. And this mainly related to experiences and interaction with peers and with recreation staff. And our findings showed that social connectedness had an important influence on the other factors. So positive social connection was a really strong facilitator and it could overcome other barriers. But vice versa, if negative experiences occurred, then it could just become an insurmountable barrier to participation. So now let's talk about the gym and why I'm looking at the gym. So firstly, it's a really popular and normal place to exercise, and it's a place that young adults with disability want to be exercising in. So big population surveys have shown us that the gym is one of the most desired places to exercise for people with disability. It's up there in the top 3 with walking and swimming. Physically, it's a safe and a feasible space for exercising, and it's really highly adaptable to individual needs and skill levels, which can be a challenge with some other options like sport. Of course, there's still considerations to do with physical space and equipment and transport. Now, the gym is a setting that has been explored in other acquired disability populations like spinal cord injury and stroke. And for these groups, it's really the social environment of the gym that has received a lot of attention. It can be seen as an exclusive place with societal attitudes and behaviours and expectations impacting on a sense of belonging. But what do young adults with CP think? So I completed a qualitative study to understand the factors influencing participation in the gym for young adults with CP. And this study was embedded within a larger gym intervention trial called Fit Skills, which ran here in Victoria a few years ago. Just a quick overview of Fit Skills intervention. It's a 12-week, twice-a-week gym program. And the key feature of the intervention is that each young person is matched up with a uni student buddy who volunteers to attend the gym and exercises alongside the young adult. So essentially they're provided with social support and they're assisted with some of the organisational aspects of getting started, like finding the gym and exercise prescription. So during that intervention, 123 young people with any disability, aged 13 to 30 years old, completed the program. And my study particularly looked at those who were 15 to 30 years old and who had cerebral palsy. So there were 41 young people who met that criteria and 39 agreed to participate in the interviews I'll present today. The average age of the participants was 20 years old and there was a fairly even gender spread. So we conducted the interviews after they completed fit skills and their thoughts and ideas were grouped into themes. And we used the family of participation related constructs to interpret the results. And I'm mindful Christine's here, so hopefully I do this justice. This is the family of participation related constructs. And it looks at the way that different elements of the person, so their preferences, their sense of self, and their capabilities, how that interacts with the environment that they're in. So in this case, the gym, the context of their participation, like having a student buddy, and also their participation in the activity itself. So how involved they felt and their attendance. From the interviews, 12 sort of messages emerged which had influenced their participation in the gym. And these are shown within the coloured bubbles and kind of mapped within that framework. There were really 4 key themes though, social, psychological, organisational and cost. And today I'm largely going to focus just on the social and psychological themes. So on the left, we have the young person pre-fit skills and all the factors that were relevant there. And then encircled in the black line is the young adult post-fit skills and all of those ideas that were influenced by the changing context. And I think this is a really important illustration of the findings from this study, because what we really found was that while the physical environment of the gym was the same, changing the social environment really resulted in so many different outcomes. So before the program, there were a lot of concerns about standing out and doing the wrong thing in the gym. The young adults wondered if they would fit in with the gym junkie guys and the show-offs. And they also recognised the impact of barriers like finding time and organising carers and transport. Exercising with the student buddy was seen to really have a mediating effect on a lot of these barriers. It provided a sense of safety, accountability, and incentive to attend the gym. The peer relationship was really highly valued by the young adults, and it differentiated fit skills from their other physical activity experiences. It was different to that of working with a therapist or a trainer. The peer aspect to the program also directly influenced the psychological benefits they achieved from the program. So confidence was the most widely reported benefit. And for some, it related to developing a sense of belonging in the gym itself. But for others, it related to confidence in their physical capability and a sense of achievement from experiencing physical improvement and mastery in the gym. They also described gym exercise as an opportunity to maintain mental health, so a way to relax, clear their head and improve sleep. And this influenced their motivation and preferences for ongoing physical activity. So finding what works for me was really the key message that summarised these themes raised by the young adults. They identified that having opportunities to experience the gym was important to being able to identify what worked and what didn't. And what really worked for the young adults about fit skills was that the program facilitated social belonging, while reducing the organisational effort and cost. So our findings showed that young people with CP really valued having social support to exercise and the enabling role that that peer support can play in overcoming other perceived barriers to exercise. Our results also highlighted the role that exercise can have in positive psychological health, and that this was a really important benefit and motivator for ongoing physical activity for this group. Physical activity for people with disabilities is often focused on the physical benefits, but these young adults really valued the social and mental health benefits. And so this might be something we need to think about as therapists when we're promoting and evaluating exercise programs. So just to finish off, I just want to take you back to that thought about why you exercise and what works for you. Of course, everyone has different preferences when it comes to exercise, The gym isn't always going to be the right place for every adult with CP, but there are usually common threads as to why we keep up certain exercises, and also why just telling people to exercise more often doesn't work. And I think most of us can probably recognise that the way that you feel when you're exercising is critical to finding what works for you. And it's those things that are quite hard to put your finger on, but do make a big difference. That feeling like you belong in a place, and how you feel before, during, and after your exercise. So I'll finish up with that and open the floor to questions. I'll just put the details here for CP-Achieve if anyone wants to find out any more information about today or future presentations, or the contact details are here. Thank you.